Developing a teaching plan for patients with hypertension. Introduction. Based on previous assessments, it can be concluded that one preventable disease that the adult participant can prevent is hypertension. The condition is concerning since it can develop without specific symptoms. However, the impact it has on a person's heart is vast and can lead to severe consequences. The modifiable risk factor that can help the individual in question lead a healthy lifestyle is diet. The purpose of this paper is to develop a teaching plan for the patient that would help them maintain a healthy lifestyle and avoid hypertension in the future. Hypertension overview. The disease is characterized by high blood pressure in the arteries. It is a chronic state, which leads to heart issues because the organ is overloaded because it has to work harder for the blood to circulate through vessels. Several issues are connected to diagnosing the condition due to its nature. It has been described as the silent killer because there are no particular symptoms present at the initial stages of developing hypertension. Blood pressure assessment is the primary approach to identifying whether a person is at risk or has the disease. 120/80 to 138/89 mm of mercury indicator for blood pressure is regarded as a prehypertension state. In cases where the levels are 140/90 mm of mercury or higher, a patient is diagnosed with the illness. Some relevant information from the health history and general survey was assessed concerning hypertension. JAA had complaints of chest pains and was previously diagnosed with the condition. MP has a family history of hypertension, including her father who has had 2 heart attacks. This information helped identify that in both cases the individuals are at risk. This presents a chance for both patients, thus, modifiable factors should be adjusted to ensure that possible adverse outcomes are mitigated. Additionally, MP should monitor blood pressure as a physical assessment tool to be able to identify a prehypertension state. Evidence-based intervention. An unhealthy diet can lead to many preventable chronic conditions, thus, patients should pay particular attention to what they eat. According to the American Heart Association, a diet high in sodium or salt is among the modifiable risk factors for hypertension. The resource recommends focusing on various types of food to ensure proper nutrition. The factor is substantiated by Ibekwe, who states that additional issues may be presented by high-fat food. The author argues that regular physical activity and a diet plan that considers foods that may lead to increased blood pressure can help a person avoid developing the condition. Analysis of the literature has shown that hypertension is a dangerous disease, however, most of the factors that contribute to it are preventable. The short-term goals for JAA and MP are to introduce the dietary approaches to stop hypertension, method. This includes a smaller number of processed foods and salt. Instead, the patients should focus on eating fruits and vegetables and other dishes that do not contain fat. The long-term goals are to ensure that patients can monitor their blood pressure, lose weight due to proper diet, and maintain a healthy lifestyle. Risk factor has a significant effect on their health. Thus, specific statistics regarding and hypertension can provide a better understanding of the chosen approach. For instance, Siervo et al. State that a proper diet can lower the overall risk by 13% when using the Framingham Risk Score as an evaluation tool. Additionally, it is essential to ensure that family members are aware of the potential problem and can support healthier eating habits for both patients. This is especially important for MP because in her case a family history of hypertension is present in both her and her husband's relatives. The specific steps would include assessing the current diet approaches to determine which factors provide a risk for hypertension. Then, the patient should modify food choices that are not healthy. Various websites include dishes that were created concerning the method, for instance, Mayo Clinic offers a good selection. The process is aimed at long-term changes, thus, the patient should focus on getting used to foods that they both enjoy and consider healthy in regard to Evaluation. The blood pressure of the patients should be assessed and monitored to evaluate whether the implementation of the plan was successful should be assessed and monitored. The approach is recommended by Ibekwe as a primary health assessment tool for hypertension. This should be done regularly to ensure that the chosen diet approach is helpful. In case the intervention is unsuccessful, other modifiable risk factors should be examined, such as stress or high cholesterol. Summary. Overall, hypertension is a severe disease that presents no symptoms in the initial stages of development. Thus, the patient may not be aware of the issue for extensive periods. However, both JAA and MP have a family history of the condition, which is a non-modifiable risk factor. The two patients should adopt the DASH diet approach to eliminate foods that can cause high blood pressure in the long term. Patients who are taught proper dietary procedures can mitigate the risks of hypertension.